Welcome back to What's Now, continuing our focus on your health. Recently, there was National Cancer Survivor Day. It's a devastating diagnosis. And what do you need to know to find help, to find resources and support? Well, let's find out.
Cholangiocarcinoma, or CCA, is a rare cancer that arises from the cells within the bile ducts. Patients with CCA are often diagnosed at an advanced stage because symptoms can be nonspecific as the cancer develops. In fact, recent survey results found that most patients waited nearly 2 years to receive an accurate diagnosis. Joining us now to discuss this rare cancer and technology that can provide important information about a patient's disease is Dr. Rachna Shroff, University of Arizona Cancer Center, and Melinda Bachini, Director of Advocacy for the Cholangiocarcinoma Foundation, who is living with CCA and can share her personal journey. Thank you so much, both of you, for being here today.
Thanks so much for having us.
Thank you.
Dr. Shroff, what is cholangiocarcinoma?
Cholangiocarcinoma, or CCA, is a rare cancer. It arises from the cells that line the bile ducts. And the bile ducts are basically the ducts or the pipes that line our entire liver and drain our liver. Bile fluid basically drips and drains through these bile ducts to empty into the small intestine, where it meets up with food and helps process fats in our foods. And so cholangiocarcinoma can arise along any of these bile ducts. It typically is a diagnosis seen in elderly patients, 65 years of age or greater. And because it doesn't really produce a lot of specific symptoms, unfortunately, it's often diagnosed at advanced stages and then carries with it a pretty poor prognosis.
Melinda, what has been your personal experience with being diagnosed with CCA?
Yes, so in 2009, I was 41 years old and working as a paramedic. I started experiencing some abdominal pain, some right shoulder pain, and fatigue. I went to my primary doctor and told him about this, and thankfully he sent me for an ultrasound, which revealed a large mass on my liver. At that time, they told me not to panic. They thought it was probably a benign tumor called a hemangioma, but tests proved that it wasn't, and I was sent for a biopsy that showed that I did have cancer. They weren't sure what type of cancer, so at that point it was labeled cancer of unknown primary. And then 3 weeks later, when I had surgery to remove the tumor in 2/3 of my liver, that's when I got my official diagnosis of cholangiocarcinoma, which of course I'd never heard of. And, we did some research to find out more about it, and thankfully so, because the cancer returned 3 months later, and then I was a stage 4 cancer patient. And my husband and I knew at that time that we really needed to act quickly.
What a devastating experience and diagnosis, and you're rather young to be diagnosed with CCA.
Yes, I was 41 years old, and like Dr. Shroff mentioned, typically it's the average age is 65 or older.
Dr. Shroff, a recent survey among patients with CCA highlighted challenges patients face. Can you tell us about some of the key findings?
Absolutely. So this was a survey of about 700 patients with cholangiocarcinoma. It was performed by Insight, with whom we're partnered and we're here on behalf of. And basically what we found was that most of the respondents, it took about 2 years from the onset of symptoms until they actually reached a diagnosis of cholangiocarcinoma. And 35% of patients actually said that they were diagnosed inaccurately with a different type of cancer before they reached the CCA diagnosis. The other kind of interesting finding, important finding, is really that while the physical burden of this disease is obviously huge, the mental health burden is also a big issue. And about half of the respondents had symptoms really consistent with major depression. So understanding the psychosocial impact of this cancer on our patients is really important for us as healthcare professionals as we think about a treatment care plan.
And doctor, can you tell us about any recent advancements in diagnosing and treating CCA?
Yeah, the most exciting area right now, I would say, is in the realm of biomarker testing. The idea of biomarker testing is to take the patient's tumor tissue, usually in the form of a tumor biopsy, and to look for the individual mutations that may have caused the growth and progression of cholangiocarcinoma in that patient. So what they do is they look for changes in DNA within the tumor and produce basically an individual mutation profile. And that individual mutation profile can then be used to personalize treatment options and hopefully open up more therapeutic options for our patients. And that's really what makes biomarker testing so important in this disease, and trying to get it done at the time of diagnosis and having patients advocate for it and having doctors know about it and ordering it is really important.
Melinda, what advice would you give our audience about navigating a cholangiocarcinoma diagnosis?
Yes, so as a cholangiocarcinoma patient and also as the director of advocacy with the Cholangiocarcinoma Foundation, I strongly encourage patients to educate themselves about this disease, to become their own advocate, their own patient health advocate, and to ask their providers about biomarker testing early on, and to also seek second opinions from experts in this disease. They can also go to testmycholangio.com or to the Cholangiocarcinoma Foundation's website at cholangiocarcinoma.org for more resources, materials, and for support.
And Melinda, what were some challenges you faced following your diagnosis, and how are you doing today?
Yeah, there were many challenges. Like I said, I was 41 years old, and I'm actually a mother of 6. So the biggest challenge was probably the deteriorating quality of life that I experienced. I was used to being physically active and chasing around kids, and that really put a damper on it. But I'm doing well today, 11 years later, thankfully, and that's why I'm here to advocate and help patients educate themselves about things like biomarker testing and to get the support and resources they need.
Well, thank you so much, Melinda and Dr. Shroff, for joining us today here on Park City Television with this important information and discussion about cholangiocarcinoma. We appreciate your time.
Thank you so much for having us.
Thank you for having us.